Benzodiazepines. I have sort of a love-hate relationship with this group of medications. This is Dr. Barnes here, board-certified psychiatrist. The first thing that I'll say is obviously these work, okay? I mean, if you have anxiety or panic, worry, these kind of symptoms, this is a medication that's very predictable. You take it, it will address those symptoms pretty well. The issue is tolerance. It can be very difficult to come off of them, obviously, and it has abuse potential, dependence. And the withdrawal can be really dangerous and life-threatening in some circumstances. So what I tell folks is these are designed to be as needed. They should never be 7 days a week. And it should be more of an average. So some people, unfortunately, their anxiety is so bad that they do require it 7 days a week. And some folks, I guess, have discussed a risk-benefit ratio with their clinicians and have decided that that may be the best route. But if you're able to not, then I try to teach people kind of a way of thinking of averaging. So let's say you do 3 days a week or 4 days a week it's used. If it's more often than not, then you're starting to get into territory where dependence can happen. And then it could be very difficult to come off of. So let's say there is a week that you do use it every day, 7 days. And I would tell somebody, well, what was happening during those 7 days? If it was a very stressful week, let's say the in-laws are over, or if it's a week that's difficult at work and you have a lot of presentations or similar, then okay, then you used it that week effectively to help you function better. But I would want people to be cognizant when that happens. Briefly, how do they work? They work by increasing GABA. GABA is a neurotransmitter in the brain that's inhibitory, which means it kind of tones down the electricity in the brain and helps people calm down. Medications include alprazolam, which is Xanax, Ativan, which is lorazepam, clonazepam, which is Klonopin, diazepam, which is Valium, and Librium, which is chlordiazepoxide.